Hello, I'm coming to you today with Case of the Week. This week's case has to do with opioid withdrawal. I recently saw a patient who was a 45-year-old male who presented to the clinic with the chief complaint of stopping his morphine, high-dose morphine. The patient had been taking high-dose morphine, 45 milligrams in the morning, 30 milligrams at night, and then 15 milligrams as needed for any breakthrough post-surgical pain. He had been on this medication for approximately 6 or 7 years, and because of the recent death of Prince from an opioid overdose, he decided he wanted to stop his medications. The patient presented to me, and his complaint or his concerns at that time were insomnia, fatigue, excessive diarrhea, and shakes or anxiety. The patient did not want to take Suboxone and did not want to go back on his morphine. The patient was asking me for medications to help get him through his withdrawal symptoms. Withdrawal symptoms from opioids are not like withdrawal symptoms from alcohol. They're uncomfortable, but they're not as significant or severe as the alcohol withdrawal. Opioids cause an addiction by the long-term changes they make to dopamine and GABA. Dopamine does many things in the body. However, one of the things it does is to produce euphoria, which is why patients typically like to take the medication or become addicted to it. Production of GABA helps to regulate the dopamine. When patients take opioids, the GABA becomes suppressed, so the dopamine levels increase, producing a state of euphoria. The euphoria associated with opioids is the main reason people become addicted to it. When these opioids are stopped, the GABA increases and the dopamine levels drop. This stimulates the opioid withdrawal symptoms that are currently associated with that, to include irritability, headaches, uneasiness, restlessness, diaphoresis, tachypnea, and pupillary dilatation. Some of the later symptoms, which is what I was seeing in my patient, include nausea, vomiting, diarrhea, fever, tachycardia, muscle spasms, and piloerection and diarrhea. Withdrawal symptoms for opioid withdrawals typically last 7 to 10 days, with the peak incidence of adverse reactions occurring at 36 hours. The patient was started on medications, which you can see here. Those 4 medications to help through the withdrawal symptoms are tramadol, clonidine, Imodium, and hydroxyzine. You can see that the tramadol dose is a tapering dose, which starts at 100 milligrams every 4 hours for 24 hours and tapers down to 50 milligrams BID. That's a 6-day taper. And this basically, the tramadol is a non-narcotic pain reliever, which helps relieve some of the opioid effects on the body, helps the withdrawal symptoms such as anxiety, diarrhea, and GI distress. Patients also placed on clonidine, which is a sympatholytic medication which blocks epinephrine and norepinephrine. By lowering some of these sympathetic activities, we can also reduce some of the withdrawal symptoms seen with opioid withdrawal. As you can see, the dose is right here also, 0.05 milligrams to 0.1 milligram every 2 hours as needed. And then due to the excessive diarrhea, we all know that opioids cause constipation. Well, when you stop those opioids, excessive diarrhea occurs. That can be managed with Imodium, as you can see there, dose-wise, and then for the breakthrough anxiety symptoms that come along with the opioid withdrawal, you can use hydroxyzine. Again, 25 to 50 milligrams every 6 to 8 hours as needed for any breakthrough anxiety. Hopefully, when you see your first or next patient with opioid withdrawal symptoms, this case can help you out. Thank you.